Hello and welcome to the Acupuncture and Chinese Herbal Medicine Case Review podcast. My name is Daniel Rose, and this was formerly the Acupuncture Storytime podcast, but we are changing it to be more practitioner-focused. And the reason why is because when I was fresh out of Bastyr University in 2016, I really wished for more content and media that had good case studies for acupuncture and Chinese herbal medicine that I could learn from. And not just books, but I don't know, like people talking, clinical mentors. And I'm going to be the first person to say, like, don't use me as your clinical mentor. You know, there's a lot better people than me, honestly. But not everybody's putting their stuff out there. So I just want to share some of the wins and some of the successes and thought processes that led to really good resolutions to difficult cases, so that if you ever have similar cases, you as a practitioner, which is who I hope is watching, can benefit from it. So let's jump right in. The case I want to talk to you today was something that scared the heck out of me. It was a woman who came in 38 years old, and the issue was back pain and polyneuritis. So she had really severe stabbing back pain, and what was also weird about it was that it came with a burning sensation in her abdomen, and she felt like it was tied to the back pain. And she had a UTI, and she got doxycycline for it. And for whatever reason, when she took doxycycline, all the back pain also went away. And that had been going on for over a month, and she had been to a chiropractor for it and didn't get any benefit. But what was scaring her more was something new that was developing, which was numbness, tingling, burning sensations, and a loss of strength in all four limbs. And she was also starting to now feel electric shocks coming up to her face. And she was really scared of this because she had been to different doctors and specialists, and nobody could tell her why or what was going on. So she was doing like a desperation move of coming to a acupuncturist, Chinese medicine doctor. So going over her case history, just other interesting things. She had a history of multiple miscarriages, and she had one of these super Spleen Qi deficient tongue and pulse combinations, very weak pulse, pale, puffy, teeth-marked tongue. And then the other thing that was interesting was that I did acupuncture on her back pain, and I'm a pretty gentle needler, but every needle I did, like, she acted like she was stung by a bee. She was hyper sensitive to touch and to the needles. I kind of felt like I didn't want to continue, but she really wanted resolution, and it turned out it was helping her back pain, so we went with it. But that was interesting. Looking at this case, I was kind of just thinking in terms of fundamentals. I remember I had this sheet of paper for when I was a student that said, if somebody's having numbness and tingling in their extremities, that's dampness lodged in the channels. If somebody's having a burning sensation in the extremities, that's heat lodged in the channels. So I'm thinking this is just damp heat on a backdrop of Spleen Qi deficiency. Let's just look at it simply this way. So the herbal formula I want to use for this, damp heat, Sumyawan. However, I was really freaked out about this case because this woman was really ill and she was really scared. So I called one of my clinical mentors, Andy Ellis, who's the creator of Springwind Herbs. He wrote a bunch of books. Fabulous guy to have to advise you on herbs. And I explained the case, and he suggested, why not Beixie Feng Qingyan? And I said, well, I really still like Sumyawan. Maybe we could do both. We can combine it. And he said, sure. But I also like to get a second opinion. And so I called another one of my clinical mentors, Daniel Altschuler, who's a professor in Seattle, who also very sharp in herbs. And he said something that took me by surprise, which he said, Sunisan, to move heat that's trapped from constraint. And I was thinking, where is that coming from? Like, I really see the damp heat on the Spleen Qi deficient picture, but okay. Anyway, so I went with the formula of Beixie Feng Qingyan plus Simyawan, and I'm going to link, go check the description because I'm going to put exactly what the formulas were in there and the dosages. And I gave that to her for, I think, 7 days, maybe 5 days, whatever, you'll see. And it didn't really help very much. And she came back in and we did another acupuncture, and she was really panicking and despairing. I said, let's just stick with the system, keep going. And I ordered her another week of herbs. Same formula, but I just added in Dongshan, Fuling, and Baiju for the Spleen Qi deficient component. And you know what? She came back the next week and she said, this actually is doing a little bit better. It was a little bit less of the tingling and the burning and the shocks. And the back pain was still bad, but we kept working on it with the acupuncture, and she was a little less sensitive to the acupuncture than she was in the past. So I took that as a good sign, and I gave her another 10 bags of the same formula. And she came back and was doing really significantly better. And one of the new symptoms that popped up was, maybe it wasn't new, but it was something that was really showing up, was a cold hands and cold feet. And I thought about what Daniel Oldschouler said, Sunny-san, and her pulse after all the Spleen Qi tonics was popping up, and it was turning out to be really wiry. Sometimes you have that situation where somebody's too deficient to feel the stress in their pulse, and then when you throw in stomach 36 and all of a sudden it turns super wiry. That's what happened with these herbs. Her deficient pulse turned wiry, and I was like, whoa, okay. And I put her on a week of Sunny-san, and then after that, which was, I think it was 3 bags of the damp heat and Spleen Qi tonic, the damp heat trainers and Spleen Qi tonics, and then a week of Sunny-san, the back pain resolved, and the numbness and tingling, she said, was 95% gone. The burning was gone, and it was like a new person. And that is an incredible case because nobody could figure out what was going on with her. And we just, with Chinese medicine, just stuck with fundamentals. Oh, there's a burning sensation in the extremities, there's heat. It's a numbness, tingling sensation in the channels, it's damp. And it's on a backdrop of obvious Spleen Qi deficiency. Just simple fundamentals, and it worked. And then pivoting to release constraint at the right moment after that. So I hope you enjoyed the case, got something out of it, and at least a confidence booster in the strength of Chinese medicine. What we do can be so amazing. And if you liked this, leave me a comment because that gives me some encouragement, and we're gonna go forward with it. One more thing we got to talk about is that if you are an acupuncture clinic owner, not only do you need to be really good at Chinese medicine and spend time studying, you also need to be really good at running a business, because what we do is way too good not to be compensated well, and a lot of acupuncturists that I know are really struggling to get the profit that they need in order to support their families, and that just doesn't seem right. So if your clinic could be more busy and have more people and needs better marketing, if your clinic is having struggles with operations or cash flow, here's my recommendation. You've got to use AI tools because this new technology can so profoundly help your business. It did for me. I spent a lot of time this summer developing a custom AI that understands my clinic and my goals and my dreams and everything I've tried in terms of marketing and in terms of operations. And I used it to generate strategic advice and technical advice on how to run the business of the clinic. And the results were so profound and so spot on. And I did this also for a couple friends of mine who are acupuncturists, and then a couple friends of mine who just are entrepreneurs and small business owners. And every single time utilizing this new technology, people got incredible results, and their profit increased, and they got clarity and less stress. So if you're running a clinic and you're not having the profit, the patient flow, if it's stressful, I highly recommend you try this. If you don't know how to do it yourself, I actually created a system where I could build a system for you. You can go to a website, cothinkcoaching.com, and with 100% money back guarantee, I'll go and get all the details about your acupuncture clinic and what your goals are from it, and build a custom AI that understands it and can create a strategic direction that you'll see has a very clear path to better operations and better profit for your clinic. And if it doesn't, then you get all of your money back instantly. But so far, I've been doing this for a lot of people, not just in acupuncture, other fields too. Not a single person has taken the money back guarantee. So there's no risk to try it. Go to cothinkcoaching.com and sign up for a 1-hour Zoom business consulting session. We'll build you a custom AI that will transfer ownership over to you, and you can continue to use it forever, and you'll see your business just skyrocket. So worth a try, no risk, cothinkcoaching.com. Thank you so much for listening to the Acupuncture and Chinese Herbal Medicine Case Review podcast, and I hope to get a new one up soon.